In this video we will talk about fainting, home remedies for syncope or fainting. Don't forget to like, share and subscribe to our YouTube channel to be notified when we upload new videos daily. Home remedies for syncope or fainting. Syncope is a common disorder of temporary loss of consciousness and posture, described as fainting or passing out. It's usually related to temporary insufficient blood flow to the brain and annually affects 6% of elderly persons and accounts for 3% of emergency department visits. Syncope is an important heart problem, is disabling, costly, may cause grievous injury or may be the only initial sign before the sudden cardiac death. Evaluating cause of syncope is difficult as brain, heart or some metabolic abnormality could be responsible for the same. The probable cause of syncope is established in only 75% of cases. The annual cost of evaluating and treating patients with syncope in United States alone is a staggering $800 million. The common faint or vasovagal syncope. Most of us remember that in our morning school assembly, a student would fall on prolonged standing. On lying flat on the ground he would recover promptly, and such episodes were more common during sunny days. This was actually vasovagal syncope or the common faint. This is more common during emotional stress, pain, after a hot shower or in warm environment. It is seen mostly in young women and is more often than not associated with warning symptoms such as nausea, blurred vision or lightheadedness. But there are many more forms of syncope, with many causes, apart from the vasovagal syncope. Tilt table testing and other tools. The gold standard test for the diagnosis of the common faint is tilt table test. This is a simple non-invasive method for recognition of this condition. Keeping the patient in upright position for 30 to 45 minutes at an angle of about 70 degrees performs this test. The test is done on a special mechanized examination table with safety belts and footrest. Sometimes an additional drug is given to enhance the positivity of the test. The positivity of the test is defined as development of syncope or slow heart rate with drop in blood pressure. The syncope observed is usually reversible on making the table horizontal or after giving additional drugs to the patient. The test is generally performed in a susceptible population where recurrent disabling syncope episodes or a single episode has occurred. But in presence of organic heart disease the test is contraindicated. Other investigating tools for the diagnosis of syncope include careful history taking, holter monitoring, echocardiography, stress testing, signal-averaged ECG, event recorder and electrophysiology testing. A proper neurological examination completes the appropriate workup for this condition. Signs and symptoms of fainting. Signs and symptoms that you might have before you faint include lightheadedness, feeling warm, blurred vision, sweating, heaviness in your legs, confusion, yawning, nausea and sometimes vomiting. What causes of fainting? Fainting often happens due to a simple, non-medical cause, such as standing up for long periods of time, feeling emotionally distressed, seeing something upsetting or disturbing, such as at the sight of blood. Rarely, it may be the result of a health condition, such as heart disease, decreased blood flow to the heart or irregular heart rhythm, low blood sugar, seizure, panic attack, problems regulating blood pressure, severe blood loss. Natural remedies for fainting. Any serious underlying health condition should be treated. When a person faints, raise the legs to help increase blood flow to the brain. Loosen any tight clothing. Apply cold water to the person's face. Turn the person's head to the side to prevent vomiting or choking. A pregnant woman should lie on her left side to relieve pressure on the heart. Warning: none of the information on our videos is a substitute for a diagnosis and treatment by your health professional.